that's coming to get tested has hard stomach pain, nose run, dry cough, chest pain, no fever, but everything else she said meets the criteria. She's on her way. She said 12:15, we'll take it.
Wednesday night, I didn't sleep because we had our first case in West Virginia. 2 cases, north and south. And I knew in northern West Virginia, they are doing drive-through testing. I contacted someone up there who's in charge, and I said, why are we not sending these hospitals down here? Why aren't they not doing it? And he said, we will try to get the health departments involved. And I said, well, if it's okay with you, I can like to do it. He said, go ahead. Tell him I'm late. I'll call him in a little bit, please. There's someone who's waiting online. If he needs his medicine, can you just tell him we'll call it in, please? I didn't go to work the next day. I spent 5-6 hours on the phone trying to figure out how to get enough testing kits, who's going to pick up the samples, you name it, logistics involved. And the next day we had this tent popped up and we had our 50, 60 calls on my answering machine. So to me, if somebody wants to do something, all they have to do is do it.
Yeah, so this is probably one of the ones that have called that got their doctor's note. We had 2 that called and said that they just needed to know that we were still doing it. They had their doctor's note, had all the symptoms, and was deemed to be a person who would fit COVID-19 testing. So hopefully this is a negative one too.
We're in a rural area. You know, Beckley is considered a rural area compared to other cities. So our hospital is 170 bed, 200 bed hospital. You're looking at ICU beds with maybe 8 to 10 beds. So if you think about it in that capacity, you're looking at about a city that can hold maybe 20 ICU beds. If you get 20 cases of COVID-19 in itself that are severe, forget about the patients who are already critically ill. People are forgetting that the hospital already has critically ill patients. So we can't handle that just in sheer quantity. You know, West Virginia, we were able to prepare in a sense because we were the last state with any positive cases. So in that way, we were able to build up something. But at the same time, because of that, I think people have a false sense of security. They think we don't have any of these cases here, but it's also with a lack of kits.
All right, we'll go ahead and swab you.
Okay.
I do think we should have more tests. I don't understand how a country like the United States doesn't have that capability.
1 minute.
It's not as bad as I thought. I heard it was uncomfortable. It's not too bad.
We only were sent to our state level 500 testing kits. So to date, I think we've tested, I believe, last night I read 464 tests have been done. 16 are positive, 4 are pending. But people don't realize only 466 people have been tested out of an entire state.
Are you tested out here?
You know, so it's a little questionable what's going on in the state, that we probably have missed some.
On the Senator Manchin's newsletter, he claims that ARH and Raleigh General are testing. I asked Dr. Gull, she said no. I don't know if the hospitals are testing.
We started out with only 8 kits on Friday. We had 20 more delivered to us Friday evening. So we're out there now with more. We're supposed to get more. So any amount we can start with, even if you can get that one person and they're positive, you can stop the spread. That can save a whole town if you can isolate them, because people here were not listening to isolation.
He said we just started in-house testing today.
Okay.
When LabCorp and Mayo did it, it was like 400. I would have thought more. Also, her testing was going to be covered by government. I'll update you in a few.
That's what Trump said on the speech, but
That all tests will be covered.
that's what he said. But I don't know how people could. Not having a lot of tests, of course, makes any doctor or healthcare person feel bad, because you know that people want reassurance.
Do we have somebody?
And I tell people this all the time. I couldn't test myself right now. I couldn't test any family member right now unless I lied on that questionnaire. I couldn't test any staff member right now because we don't fit the criteria.
Very uncomfortable. It has to go all the way in there, dear, for about a minute. I'm sorry. You can close your window, buddy. All right.
We had a couple people even drive up today, even my own patients, thinking they can just get swabbed for COVID-19. If we had 1,000 kits, we could just swab everybody. But because people don't know what they have, it's causing this panic.
Thanks, buddy. All right. It only takes about 4 days, we've been seeing. It's not too bad.
One of my family members is a doctor here, and he told me he doesn't want me to do this drive-through testing. He said, I don't want you to do it. It's dangerous. The health department that's their responsibility. I said, no. I said, listen, it can affect any of us. It can affect anyone in our family. If anything, I can stop it, because what if it affects one of you guys? Doesn't matter. I said, we have to test. We have to test this community. She's on our little paper there. She's on my list here.